According to National Institutes of Health, there are at least 80 autoimmune diseases that we know of today, affecting 5 to 8% of people in America. The number may seem small, but that's 24 million Americans. Compare that number to 9 million people affected by cancer or 22 million people affected by heart disease. The number of autoimmune diseases are increasing rapidly, but today we're going to talk about America's least recognized major disease, known as lupus.
It is estimated that at least 5 million people in the world have lupus, and 1.5 million of them are in the States. If you know Lady Gaga, Nick Cannon, Michael Jackson, Toni Braxton, Seal, Snoop Dogg's daughter Corey Brodus, Tim Raines, Charles Kuralt, or even Millie, George and Barbara Bush's dog, then you know someone who has lupus. More than 16,000 new cases of lupus are reported annually across the country. Those are relatively small numbers since lupus is not contagious, not even through sexual contact. You cannot catch lupus from someone or give lupus to someone, but what's most interesting about this disease is who exactly it affects. More than 90% of lupus sufferers are women. Most are young women of childbearing age, between the ages of 15 to 44. Men and children are teenagers can also develop lupus. Men are at a higher risk before puberty and after age 50. People of all races and ethnic groups can develop lupus, but as you may have noticed with the list of celebrities, people, especially women of color, are 2 to 3 times more likely to develop lupus than Caucasians.
But what exactly is lupus? Lupus is the most complex and unpredictable of all diseases. Lupus is a chronic disease, meaning that the signs and symptoms tend to last longer than 6 weeks and often for many years. And it is an autoimmune disease, meaning that your body's immune system attacks and destroys healthy body tissues by mistake. Lupus can be mild, moderate, or severe, since it can damage any part of the body, from kidneys, brain, heart, lungs, to even your skin and joints. In acute cases, lupus can cause permanent damage to some of these vital organs. Although lupus is used as a broad term, there are several different types of lupus. Systemic lupus erythematosus, SLE, is the form of the disease that most people refer to when they say lupus, which is the most common form of lupus. Symptoms can be mild or severe and can affect major organs in the body. The word systemic means the disease can affect many parts of the body, including the kidneys, brain, or central nervous system, blood and blood vessels, skin, lung, heart, and joint. Cutaneous lupus erythematosus, CLE, cutaneous meaning skin. This form of lupus mainly affects the skin and can cause rashes and lesions, hair loss, ulcers, and photosensitivity. Drug-induced lupus is a lupus-like disease caused by certain prescription drugs. Most of the time, the disease goes away when medicine is stopped. Lastly, neonatal lupus is a rare condition that affects infants of women who have lupus and is caused by antibodies from the mother acting upon the infant in the womb. But it was also possible for an infant to have neonatal lupus even though the mother is healthy. However, in these cases, the mother will often develop symptoms of lupus later in life.
Where does the disease strike in the body? In lupus, the immune system, which is designed to protect against infection, creates antibodies that attack the body's own tissues and organs. The antibodies circulate in the blood, but some of the body's cells have walls permeable enough to let some antibodies in. These can then attack the DNA in the cell's nucleus. So what this means is that it can attack nearly every part of the body, such as all vital organs, the kidney, liver, heart, skin, including the joints, muscles, knees, hands, fingers, and wrists, which attack both sides of the body at the same time, resulting in inflammation within the body. Prednisone and other corticosteroids are generally prescribed to stop the inflammation, though it does vary from case to case. For some people, it only affects a few parts of the body. Over time, more symptoms can develop. Having lupus increases your risk of other health problems that are common in women. It can also cause diseases like heart disease, osteoporosis, and renal kidney failure, which occurs earlier in life. One of the prevalent symptoms is the malar or butterfly rash, derived from the Latin word mala, which means cheekbone. The malar or butterfly rash is a kind of skin condition typically characterized by the appearance of rashes across the cheekbones and over the bridge of the nose. It is called the lupus butterfly because of its butterfly-like shape. It is the primary reason that most lupus organizations have the butterfly as their symbol.
So how does the immune system function for those who have lupus? Well, under the normal conditions, white blood cells in our bodies defend us from foreign invaders such as viruses and bacteria. Our white cells can identify them as foreign because they contain antigens. These signals when white blood cells to make chemical markers such as antibodies. Those antibodies attach to the antigens, marking the foreign invaders as targets for the immune system to destroy them. However, when individuals have lupus, their white blood cells mistakenly make antibodies that mark their own normal cells for destruction. The certain cells of the immune system that have been identified in playing a role in these diseases are T cells, B cells, antibodies, neutrophils, and cytokines cells. These mutated cells causes abnormalities in the immune system, which then leads to effects of lupus. However, this autoimmune response causes inflammation in the areas that are being targeted. Inflammation makes the blood vessels in the affected area expand, leaks fluids, which causes redness and swelling. These effects are not noticeable until people's immune systems attack different areas of the body. This is how lupus negatively affects our immune system and our tissues.
Most people develop lupus between the ages of 15 and 44, but it is difficult to diagnose because its symptoms come and go and mimic those of other diseases. There is no single laboratory test that can definitely identify the illness, but several laboratory tests of blood and urine along with clinical assessment can help make a diagnosis. The symptoms of lupus appear more apparent as people's immune system begins to attack different areas of the body. Individuals may develop a butterfly-shaped skin rash on their cheeks and nose. Small sores and ulcers may also form inside their mouth or nose. They may also develop arthritis, Raynaud's phenomenon, which is fingers turning blue or white during they are cold. Pleuritis, pain during deep breathing caused by a condition in which the outer lining of your lungs is inflamed. Lupus nephritis, your blood cells may create antibodies that attach to bits of your DNA from worn out cells. The attached pair, called the immune complex, can lodge in your kidneys and cause inflammation, or photosensitivity. Signs and symptoms that suggest an individual has lupus may also be painful or swollen joints, low blood count, unexplained fever for several days, chest pain associated with breathing, extreme fatigue, unusual hair loss, depression, and trouble thinking or memory problems.
The cause of lupus is not entirely clear at the moment. However, scientists know that it is not a disease people can catch from one another. Researchers are looking at some factors such as the environment. They believe that sunlight, stress, smoking, certain medications, and viruses might trigger symptoms in people who are prone to getting lupus. Hormones such as estrogen, since lupus is more common in women during childbearing years, and problems with the immune system. Scientists know that genes play an important role, but they are sure genes are not the only reason a person will get lupus. Even someone who has one or more of the genes associated with lupus have a small chance of actually getting the disease. Only 10% of people with lupus have a parent or sibling who has it.
These certain cells for this antibody, over time, this autoimmune response causes inflammation in the areas that are being targeted. This is how lupus negatively affects our immune system and our tissues. Oh shit, I made it through.